As we look at mental health, it's helpful to talk about change management in that it's simple micro shifts. Change management can be broken down into 3 micro shifts. If you think about empathy, choice, and routine. And the way we maintain motivation across empathy, choice, and routine as we're making these shifts in our lives is awareness and acceptance and compassionate action. In today's webinar, you're going to hear us talk about the compassionate action when we get to practical takeaways. We'll have some final takeaways, and I invite you to ask any questions so we can really make sure everybody walks away with a couple practical tactics for compassionate action. During this last year and in general, as the neuromechanics of screen time started to affect all of us more, stress became something that was harder and harder to talk about because it affected more and more mental clutter, which can lead to personality changes, changes at home, and illness and disorder. Quite literally, disorder looks like a lack of order. And if you think about it, a mental illness is just a representation of needs that are either lacking or need more attention. So as you think about what you want to take away today, I ask you to sit back and allow some of the lulls, the pauses in this webinar to kind of wash over you, because that's going to be the beginning of some of your mental health journey and that compassionate action and practical takeaway you're going to hear us speak about today. When we look at the impact of the neuromechanics of screen time, there's been a rise in loneliness, a rise in people feeling more disconnected, a rise in shallow and more shallow breathing. And you would think that because we can be so connected that it's a little bit easier to pause and to enjoy relationship. What you'll hear us talk about today is while we can have more efficiency and effectiveness because of our technology, we want that to give us the extra time for the relationship as opposed to more and more work. We lift up the idea of the warrior, of the hero who puts work first, and lots of times that has results that none of us intended, results that none of us planned for. So thinking about some of the health risks related to depression, depression interferes with a person's ability to complete physical job tasks about 20% of the time and reduces cognitive performance about 35% of the time. Specifically, once depression is addressed, it takes an additional 3 years for there to be the relief that people are looking for. So one of the things we point out in the work that I do is the sooner the better. So today we're going to talk about burnout, so it doesn't get to the point of a disorder. As we talk about a mental health roadmap, again, it's going to be simple micro shifts. So when you think about depression and some of the ways it's impacted us, the work that I do every day is about 40% of the time building up my mental health team, 30% of the time with patients and their families, and the rest learning. Change management requires us to be able to apply the most relevant information that we can to make those micro shifts easier, because a lot of us just need a routine. So you'll hear that word a few times today, and I want you to think about some of the routines that will impact you in different ways as you look at the rest of your week and the rest of your day. The challenge with mental illness is not just normalizing the discussion, as Kate mentioned, it's also thinking that it's something we're stuck with. So as we go into some of your questions and answers, I want you to think about how pain is often a messenger. It's feedback from our body. And you think about the implications of 4D stress, anxiety, mood disorders, feeling desensitized, all of those things can be the result Yes, but the feedback is what we're all going to learn to tune into just a little bit more, perhaps as a result of how connected we all are with our devices now. Now we have to tune in more to our bodies, perhaps because of the losses we experienced from COVID, or simply because pain is a messenger that we've listened to a couple times before, and we noticed that the importance of that pause rendered results for not just our health, but our relationships. A lot of the mental health roadmap comes back to feeling connected and having those relationships. Specifically, as we transition into some of the webinar, I want to just prime you with what symptoms of burnout look like. It can be a shorter attention span, numbness, tearfulness, feeling more agitated than usual, harder and harder to experience pleasure or fun, craving alcohol or sugar, harder to sleep, harder to stay asleep, and feeling as though you're not heard or understood. According to the World Health Organization, burnout means emotional exhaustion plus depersonalization and a reduced sense of efficacy. But chances are we don't need that formal definition. All of us have experienced it, especially over the last year. But what can we do about it? First, we get to know how to recognize it better. While we associate burnout in the workplace, we also know that it can show up anywhere. For example, it might arise in parenting, as the club sport parent or the brand buyer when school shopping treasures busyness as a badge of honor, or the warrior spirit of push, push, push through. When we think about burnout, it's important that we recognize that it's going to take a while to heal, just like the person that might have ignored depression symptoms for a while. In change management, we talk more about micro shifts and incremental work because that's what will last. So thinking about the choices you have in your mental health today, the empathy that you have as a choice to yourself so that you may have it towards others as well, and the routine. All of that will require a good look at, can we accept the new landscape in our work life, in our homes, now that we have most of our work there, many of us? Can we have an awareness and a pause that's different than the past? And can we take compassionate action at small, short intervals different than what we did in the past? We're going to move on from looking at the stress and how it can impair productivity and creates more superficial interaction and cynicism.
Please subscribe and check out more content from us.